Welcome and thank you for joining us today. First, I would like to thank several partners for helping to make this webinar possible, including the Minnesota Department of Health and the SNAP-Ed Community Partnership Project of the University of Minnesota Extension, in addition to our panelists from Hunger Solutions and Christian Cupboard Food Shelf. The Public Health Law Center works with partners around the state to better understand the legal challenges faced in local efforts to increase access to healthy food in our communities. Our work with mobile food shelves reflects collaboration with additional partners around the state, including Keystone Community Services, the Open Door Pantry, the Metro Food Access Network's Hunger Action Team, Prairie 5 Community Action, and others. We want to acknowledge and thank our partners around the state for their involvement and commitment to our shared vision of creating healthier Minnesota communities. Federal funding supports some of the work that we do, and this non-discrimination statement guides our work and explains the complaint process. So the Public Health Law Center is a nonprofit policy organization based at Mitchell-Hamlin School of Law in St. Paul. Our work focuses on supporting community, state, and federal efforts around the country to use law and policy to address chronic health issues impacting our communities as a result of tobacco use, lack of access to healthy food, and lack of opportunities to be physically active. So what does the Public Health Law Center do? We provide legal research, policy development, publications, and trainings. However, we do not do direct representation or lobby. So now I'm going to introduce myself. Hi, I'm Anna Larson, a policy analyst at the Public Health Law Center, and I will be your moderator for today. At the Public Health Law Center, I work with Minnesota communities to increase opportunities for access to healthy food and work to build a more equitable food system through policy initiatives and community engagement. Currently, I'm working on a project with Minnesota Food Policy Councils to support their work to increase access to healthy food through the SNAP-Ed Community Partnership Project. And I'm supporting SHIP grantees around healthy food access, particularly around community gardening. Before we begin, I would like to review our goals for the presentation. This webinar is focused on the different elements of creating and operating a mobile food shelf. From this webinar, we hope that participants will gain an understanding of the food access and hunger context currently in Minnesota, which many of you are familiar with, have tools to identify clients or future clients in your service area that would benefit from a mobile food shelf program and allow you to increase your reach. Understand how different decisions about the vehicle type and structure of the mobile food shelf will impact the driver licensing and vehicle requirements and the amount of work required. Learn an example of how these issues can play out on the ground from Christian Cupboard, and also have an opportunity to ask questions and discuss common concerns. We will also review current funding opportunities, which Hunger Solutions will do. So now I would like to introduce our first speaker, Mary Merrow, a staff attorney with the Public Health Law Center. Mary is working on legal and policy initiatives to increase access to healthy food and physical activity in local communities at the state level and nationally. Prior to joining the Public Health Law Center, Mary was a public interest practitioner for over a decade, focusing her efforts on poverty law, international human rights, and environmental advocacy. Next, we will have a speaker from Hunger Solutions. Peter Wojtak is a community organizer with Hunger Solutions Minnesota, where he advocates for hunger issues at the Capitol. He also works with the Market Bucks program to help SNAP EBT users stretch their dollars at farmers markets and helps to build capacity with the Mobile Food Shelf Network. Peter graduated in 2008 with a master's in advocacy and political leadership at the University of Minnesota Duluth. Since then, he has worked on political campaigns with nonprofits and as a community organizer with Working Families Win, where he helped organize people to address economic issues locally. Peter has a passion for working to end poverty and hunger in Minnesota. Then we will have two speakers from the Christian Cupboard Food Shelf. Sue Gilman has held several executive leadership roles in her career in global operations for Seagate Technology. Most recently, she owns and leads Superna, a global consultancy that specializes in operational performance. In 2014, Sue made a significant decision to spend 50% of her time working with nonprofits in the food insecurity sector. She is an active volunteer at the local food shelf and is now a member of two boards, Foundation for Essential Needs and Valley Outreach. Sue's active participation in business acumen has contributed to the design and rollout of many new programs for local and rural food shelves in Minnesota. Sue has an MBA from the University of St. Thomas and a BBA in finance from the University of Minnesota. She has held a faculty position at the University of St. Thomas for 15 years. In her free time, she enjoys golf and travel photography. Greg Metzger is the Executive Director of the Christian Cupboard Food Shelf. He took this post in 2014 after 2 years as a board chair. Greg brings both corporate and entrepreneurial experience to this position, having held a variety of senior management, marketing, and operational roles in both business-to-business and consumer corporations. Greg has a BA in economics from Princeton University, along with an MBA in finance from New York University. He and his wife live in Woodbury, Minnesota. So, mobile food shelves have been receiving increased attention and awareness in the past several years, as more food shelves have looked at innovative ways to reach clients who may not be served by traditional food shelves or who face barriers in accessing food shelves. First, I would like to provide some context. In 2015, 11% of Minnesotans reported experiencing food hardship. In 2014, there were 3.34 million visits to 300 food shelves, which is 9,000 people per day. This is a 4% increase from 2013. Additionally, in 2014, Minnesota lost the federal waiver to enroll able-bodied adults without dependents between ages 18 and 50 in the SNAP program for longer than 3 months, which resulted in 89,000 individuals losing their SNAP benefits. When thinking about access to food, it's helpful to look at where the trends are. Of the number of visits to food shelves in 2014, 50% of visitors were adults, 8% were seniors, and 38% were children. Over the previous 5 years, food shelf visits increased 6%, but senior visits increased 24%. I think the folks from Christian Cupboard will talk about this more, but as we are anticipating an aging senior population in Minnesota, we can see how food insecurity may impact them more greatly than other populations. So, as we started discussing, individuals may face barriers in accessing food shelves, such as mobility challenges, lack of accessibility infrastructure, lack of transportation options, limited food shelf locations, and a stigma that prevents those in need from utilizing food shelves. As a result, the most vulnerable individuals tend to have the least access. This graph illustrates how some of the barriers mentioned on the previous slide can work together to limit access to food. This graphic shows the overlay between federally designated food deserts and areas with low vehicle access. As you can see, there is some overlap. Mobile food shelves have the potential to be able to impact many of these barriers, such as mobility, transportation issues, and low retail access for limited food shelf locations. So this slide illustrates the difference between equality and equity. For example, just because a food shelf is in a particular neighborhood doesn't mean that everyone in the neighborhood will be able to reach the food shelf. Some people may face more barriers than others, such as the barriers discussed on the previous slide. Mobile food shelves can be a way to reach individuals who face even higher barriers than food shelf clients and meet people where they're at. So, what is a mobile food shelf? A mobile food shelf is a vehicle that brings groceries to people. Oftentimes, some of the food is perishable and may require some form of refrigeration, and there are different food distribution models, and they have the ability to provide food to people where the need is greatest, addressing some of the barriers mentioned previously. Our speakers for today will go into more detail. So now I would like to introduce our first speaker, Mary Merrow at the Public Health Law Center.
Great, thanks, Anna. I'm really excited for you to be joining us on this webinar today because, as Anna mentioned, this interest in mobile food shelves has really been growing around the country and in Minnesota in the past few years. And I think that on an earlier slide, Anna included a snapshot from a recent Star Tribune article, I think just from a couple weeks ago, talking about the increase in mobile food shelves in Minnesota and the potential that that food delivery system has to really address a growing need in the state. And at the same time, the work that we've been doing, that we, the Public Health Law Center, have been doing around the state, we've been hearing from partners and different community groups about some challenges that they're running into in going from more traditional or bricks and mortar food shelf operation to having a more mobile system. And so one of the things that we try to do here at the Public Health Law Center is to really listen to your experiences. And when we start seeing that there are certain themes and challenges from a legal perspective that you are running into and that these challenges are interfering or or making it more difficult for you to meet your goals in serving your community, then we look for opportunities to share that information and to really kind of enhance the learning curve here as a state and as people with a shared vision and passion for meeting the needs of our most vulnerable Minnesotans, to provide the information that you need so that you can be successful with your efforts. And so I really hope that this webinar will be a tool that you can use in advancing your efforts to feeding hungry Minnesotans. And with that, as we've been talking to different people around the state, we've come up with a kind of like 4 key areas that we think encapsulate where people are having the most questions or conversations about how to work with mobile food shelves and how some of the legal issues may be different or questions if they are different from regular food shelf operations. So I'm going to spend the next few minutes going over some of these key areas, and then also just want to let you know that we are finalizing a resource that will be available on our website that goes into some of these issues in more detail. But this should provide you with kind of a snapshot of things that are coming up, and also just to let you know that we are available if you have questions in response to some of these things. So first of all, I think that there's questions about kind of 2 different pots of the mobile food shelf. You have the food, which involves food establishment regulations and licensing and food handling or food safety issues, and then which food shelves are generally, are familiar with, right? Except that when you put food on a mobile system, some things get a little bit more interesting, or can. And then you also have the other pot I would call the vehicle driver piece. So I'm going to start with the food establishment and food safety regulation component of things that we've been hearing from folks. And so one of the questions really is, so what is a mobile food shelf? Is it something new? Is it something that we need to have new regulations for? Is it like how to understand this? Because it feels new to some people, and at the same time, it feels similar to other kind of food distribution services that we have. And so basically, what I want to tell you is that a mobile food shelf, while it feels different and it may be a different type of food delivery system than what a traditional food shelf may be part of, it is not, from a legal perspective, anything that is that new. We have retail food vehicles that are defined in Minnesota law, and a mobile food shelf fits under that definition. And a mobile food shelf is a type of food establishment, and then Minnesota law includes kind of an additional layer that clarifies what a retail food vehicle might be and makes a distinction between a retail food vehicle and, say, like a food truck or a service delivery that provides meal service. So I do want to make a distinction between providing food that's offered to your customers, intended for off-premises consumption, but is not subject to on-site preparation. So you're not delivering the prepared food, you're delivering the food to your customers for them to take and prepare at their home. And so there are different requirements than for direct service providers that are delivering meals. So I just want to make that distinction. And the other thing, too, is even though this retail food vehicle definition includes the term retail, under a legal framework, that doesn't necessarily mean that there has to be an exchange of funds. So the fact that you are delivering food makes a mobile food shelf a food establishment, even if there is not an exchange of money. So rest assured, this isn't a new area of regulation. It's something that we have some experience with in the state. We just haven't called it exactly this before. So keeping that in mind, food establishments like grocery stores or a retail food vehicle, like retail food vehicles, are regulated by the Minnesota Department of Agriculture, as compared to prepared foods or restaurants that are regulated by the Minnesota Department of Health. And that's an important distinction, because if you're wondering about if you have questions about food handling or food safety, who do you need to be contacting? And so the Minnesota Department of Agriculture is your go-to agency. And I wanted to just bring your attention to this food safety guideline resource on the right here. It is a little bit dated, but I checked with a couple of folks at the Minnesota Department of Agriculture last week just to make sure they didn't have other resources or if this information was up to date. And I was told that this information is actually good, and some of the contact information at the end is out of date. But I just want to encourage you to look at this because it applies both to your traditional food shelf and also to a mobile food shelf. So one of the questions that comes up a lot of time around food safety and how your food delivery in a mobile food shelf complies with the Minnesota Food Code. And the Minnesota Food Code is that body of regulations that really gets into the nitty-gritty about food handling and food safety. But one of the questions is, how do you deal with refrigeration and perishable food? And one of the things with the Public Health Law Center and a lot of our work, and I know growing interest around the state, is making sure that customers of food shelves have access to healthy food as well. And this can get a little bit more complicated when you shift from a bricks and mortar food shelf to wheels, to putting the food on a vehicle. I mean, it's hard. It can be challenging for food shelves in a set location to have the refrigeration and some of the infrastructure to support handling and storage of perishable foods. And it just gets a little bit more complicated, I think, with a vehicle. And really one of the things that I want to emphasize, and I think that the folks at Christian covered are going to mention this as well, is there isn't necessarily a one-size-fits-all with this conversation as far as how do you approach refrigeration and what's the best fit for your operation. And so one of the things I like about this slide is I think that we have kind of 4 different models of how refrigeration and food handling might be managed with different types of mobile food shelves. And so you can see the We Can mobile market on the upper right, that van. I mean, I don't think that there's a refrigeration unit in that vehicle, while the Catholic Charities modified bus, I believe, does have some refrigeration, and the high-rise East Side Neighborhood Services has a refrigeration unit included in the truck, while Christian Covered doesn't. And so all of those are viable options because, thankfully, the Minnesota Food Code and food safety regulations anticipate and allow for the use of not just a refrigerated unit, but also the use of ice or cold packs or dry ice to be used in transporting food as long as the cold temperatures are met. And so I know that we've had some conversations in the past couple of years from people who had different mobile food shelf operations, and wondering if they were if they could get in trouble for using a cooler or ice or something like that. And so I just wanted to tell you that that actually is an allowed form of transporting food, and you just have to pay attention to the temperature. And at the same time, one of the things we've been hearing from different partners working with mobile food shelves is that it isn't just the heat that can be a challenge. We were talking to one, I think, Ross at the Keystone Community Services, when he was delivering some food, and he said that they've actually found that winter can also be a challenge, and you have to plan for that because of the cold temperatures and being aware of how some of the perishable foods may be damaged if it gets too cold, whether it be any liquids or vegetables or other types of perishable foods. So it's just something to keep in mind that initially when we were having conversations with folks about food safety and food temperature was really around the heat piece, and I just wanted to mention that the cold can also be an important consideration as well. So then moving from the food piece of the equation to vehicle and driver issues. So in talking to folks around the state who have been implementing mobile food shelves, the vehicle question comes up a lot. And there's a lot of confusion around how to approach vehicles and navigating this new area that that food shelves really don't have experience in. And you're really experienced in identifying need, working with needy communities in your area, and really addressing the food need, but then you aren't necessarily an expert in vehicle and driver law. And so as people have been entering into this kind of new area that's been a bit intimidating, and it's been complicated, I believe, because I think that there's been some confusion on the part of the regulatory agencies at the state or local level about what is a mobile food shelf. And so that's why, going back to the earlier slide, to understand that a mobile food shelf is that retail vehicle food establishment, that there actually is a framework legally for governing that if you understand who you are and what your operation fits into, if you need to reach out and talk to a regulatory agency about some vehicle or driver issues, that is going to help them understand who you are so they don't inadvertently put you in the food truck or the prepared food box. So I just want to encourage you to keep in mind that how you identify legally as a food establishment is an important piece of the conversation as you work through the vehicle and driver pieces. So with vehicle issues, there's choosing the vehicle identification numbers, vehicle classification, and then getting into modifying vehicles that come up. So in choosing the vehicle, again, as I mentioned before, it really comes down to what your operations needs are, what your capacity is, the clients that you're wanting to serve, and a number of factors that are really unique to your operation. Some of the things that come up when thinking about choosing the vehicle are the weight of the vehicle, cost is a big consideration, cost and maintenance. That's one thing that I've been hearing from some mobile food shelves that have been in operation for a period of time, is that initially they were really focused on the upfront costs of acquiring the vehicle, but now they're kind of running into the maintenance things. And so, as you're thinking about your initial, if you're just getting started or if you're wanting to, sustain your operation, thinking ahead to some of those maintenance costs to a vehicle or a refrigeration component would be an important part of your planning, because you don't want to be caught unaware if there are issues that come up with the vehicle. Again, a number of mobile food shelves have modified, say, a bus, and to make it into more of a truck and a delivery service. And then another question that I think people consider is whether or not the mobile food shelf is going to have customers come onto the vehicle to shop, or if you're going to unload at every, like at a homeless shelter or at a community organization where people can come and, go to tables or have like in a location. So you're unloading and loading the food items at every stop. And another model is that some people are just, taking, the client choice model and are taking orders from some of their clients who can't maybe even get down to a community area and delivering bags of groceries. All of those questions will impact what kind of vehicle you obtain. And one of the things in a vehicle is whether or not you're going to need a U.S. Department of Transportation number. And this is something that you might not have experience with. And even though it might be a new area for you, it is not a new area for perhaps the person where you're purchasing the vehicle or other people in your organization. If the organization has trucks or other vehicles that are used, you may have some experience navigating this Department of Transportation vehicle identification. And one of the things that comes up is whether or not, it really comes down to that weight of the vehicle and how the vehicle is classified. And so the U.S. Department of Transportation numbers, there are some guidelines there about what vehicles are required to have DOT numbers. But then Minnesota also has some other requirements that may involve transportation within the state, while the U.S. Department of Transportation's regulations really involve if you're going to be crossing state borders. And, my expectation is that most of the mobile food shelves in Minnesota are operating within Minnesota, and at the same time, I can see the potential that maybe you might go across the border into Wisconsin or Iowa or somewhere to obtain food. You know, there's some partnerships that are developing across state lines. So it's just good to keep those things in mind. And in the commercial versus non-commercial vehicle classification, in addition to the weight piece, you know, that can impact the Department of Transportation identification number, how the vehicle is used and whether the vehicle is designated as a bus or not can impact how the vehicle is classified. I want to really focus on vehicle modifications involving modifying a bus to a truck. And the reason why this is important is because buses may have some different legal requirements because they are designed to transport people. So there's different safety considerations with a bus than, say, a truck that is designed to transport goods. And so a number of mobile food shelves have modified a bus, taken out the seats, and you know, added, like I think the Keystone and some others have added in the refrigeration unit in a way where customers are able to board the vehicle to shop. So it's important that you know, that you think about that. And reclassifying a bus, you know, there are some specific considerations that impact reclassifying a bus. There's some information available online that can help you manage that. And I know that there is some experience that people have that have gone through that that can help, you know, you sort through things. I think that through Hunger Solutions, they have some good contacts there, and Peter will be talking about that some. But one of the things I wanted to share is some lessons learned that we've heard about how if you want to leave just one seat or two seats, if you're modifying a vehicle from a bus to a truck. And what we've been hearing is that while from a space consideration, you just might think, oh, we'll just get rid of all of the seats in when modifying a bus. So it's just the driver, and so you have more space for food or transporting product. At the same time, we've been hearing from some folks that having an extra seat can be a really valuable asset because it can help if you have a volunteer involved, so the volunteer can ride with the driver, and also can help if your driver has to pass a driver's test driving that vehicle, so that the person administering the driver's test has a place to sit. So there's some practical on-the-ground lessons that are being learned about, you know, from the beginning that you might want to think about as if you are purchasing a bus to modify. Another area of questions comes up about driver requirements, like what kind of driver's license is required, and that again is tied really closely to whether or not it is a commercial vehicle, is a medical or physical card required, and if there are drug and alcohol testing requirements. So I wanted to direct you to, this is I think a helpful resource to help you figure out if you are working with if you have a commercial enterprise. And I think that for the most part, most mobile food shelves are not going to be classified as commercial vehicles, although it does come down to weight and, you know, some other considerations. And it gets a little bit complicated, but this resource I think can help clarify some of those questions and provide you like a Q&A form, what if, then this, and kind of a little bit of a flow chart. So that's that. We found that to be a good resource. And then been thinking about if the vehicle is classified as a commercial vehicle, what kind of driver's license requirements there are. So this is a general snapshot of what is required for a commercial driver's license. And one question comes up is whether or not a physical examination is required. And again, there's a lot of legal fine print with this, but this resource from MnDOT provides a really nice comprehensive Q&A format about physical examinations and whether or not you need to actually have a medical examination. And a kind of a related question that I don't know, it doesn't come up as much, is whether or not drug and alcohol testing is required. And as I understand it, the drug and alcohol testing requirement really only comes up if your vehicle weighs 26,000 pounds or more. And from the research that we've done, it seems unlikely that mobile food shelves are going to meet that gross vehicle weight rating classification. So when I should have clarified this earlier, when I talk about weight, I'm really talking about what the vehicle is classified to carry. It's not actually what the weight is. You know, but you have to think about what it is. Vehicles have a certain gross vehicle weight rating classification that indicates how much that vehicle has been rated to safely carry. And it includes the vehicle. For your purposes, it would include the refrigeration. It would include any food items that are included in the vehicle. And so all of those things are added up for that gross vehicle weight rating. And that would tie into then whether that drug and alcohol testing is required. But 26,000 pounds, the best I can tell, is a pretty big vehicle, and it seems unlikely that most of you or any of you would be operating a vehicle that large. So here's some more information about driver vehicle regulation. And with that, I'm really happy to turn it over to Peter at Hunger Solutions so he can start helping make sense of all this information from the experience that he's had with Hunger Solutions and working to implement these efforts on the ground.
Great. Thanks so much, Mary. And this is really a great resource. They're going to be a great resource for a lot of programs that are starting up this year with the Mobile Food Shelf Grant and even in the future. So thank you. So yeah, I just wanted to kind of take some time to go over the Mobile Food Shelf programs and answer any questions that you guys might have. So the first thing, and some of this has already been said, but why mobile food shelves? I think we've seen with an aging population just more and more people that are experiencing those barriers to making it to a food shelf, whether it's transportation related or mobility or even stigma barrier for many seniors. And so a number of food shelves years ago got together and they kind of put forth plans in their community to address these needs. And so a couple of the ways that programs do this, is, it was mentioned earlier, having a dock truck where volunteers pack the truck and then set up and take it to a community space, a community room in an apartment building or a church or a school, and set up that way. Others, like you see here with Keystone's food mobile vehicle, is a retrofitted bus where the clients can go on the vehicle themselves and shop. And so the definition that we've come up with is really bringing that food shelf experience to those who cannot access traditional brick and mortar food shelf, going through an intake process just like you would at your food shelf, and then offering similar varieties of food. There's a lot of great programs for produce drops and other things which are great to have, but as far as defining it as a mobile food program, it needs to incorporate similar varieties of food, produce, and other shelf-stable products as well. So Hunger Solutions, kind of how we got involved with this work is we saw that there was obviously a need to continue and expand these programs, and the food group and others, as you can see here, did a great job of really kind of organizing a group of mobile food shelf providers who got together and defined, best practices, and we came in to kind of help lead that work and also look at ways, how can we expand this beyond the metro and go into greater Minnesota as well. So we put together, really defined the program, what is it, and then kind of went to the Capitol, put together a bill, a bipartisan bill that was supported and eventually passed, that got us a 2-year one-time grant. And we just finished up the first year of that grant, and it went out to 17 different organizations around the state, and then I'll talk a little bit more about that later on. But it's really brought a lot of attention to these programs, not only here in the state level but also national level, because this really hasn't been done in terms of getting funding from a state government to run these programs as far as we know. So it's really been great to see how far we've progressed so far. Just wanted to mention too that this is kind of a good resource to kind of learn about some of the programs that are currently operating. Right now, a lot in the metro. We'll be updating this link just so that after the first year of the grant, reports start coming in, we'll be able to put some more organizations up on here so you can see different ones where I've been to Harbors and Mankato and other places as well. But just kind of a good resource to kind of look at who's doing this work now and what does their model look like. So I just wanted to kind of highlight too, I know some of you are probably on the call who haven't started a program or might be thinking about it in the future, so, and some of this is mentioned already, but kind of planning your program, what are some things you're going to kind of need to think about? The first thing, obviously, is identifying what are the needs in our community, who might be in need of this service in our area, and that's doing surveys, going out to do potential site visits, and you'll hear a little bit later on from Greg and Sue kind of how they focused in on many seniors who weren't able to reach their food shelf and how they went about that as well. So thinking through the different program model options, you saw on the map there's a lot of varieties of programs, basically, you know, delivering food or having the clients shop on the vehicle themselves. So thinking through which option might be better and you know, just contacting the different organizations that are doing this work now to get an idea of how they started so you don't have to really reinvent the wheel on everything. Thinking through the budget, you know, the cost of the vehicle, the insurance, the fuel, the maintenance that goes along with that. As Mary mentioned, the Department of Transportation requirements, thinking through that, and now that we have this great resource, is a good way to kind of connect with your local municipality and county to make sure you're up to speed on everything there. Thinking through insurance, the different storage options and vehicle options that are available to you. And so we also wanted to mention too, you know, we're here at Hunger Solutions to be a resource as well, so feel free to reach out to us if you have questions, you know, especially after the webinar. If you think of something, let us know. We'd be happy to connect you to Greg and Sue and others who are doing this work already. So as I mentioned, we secured this grant. It's a one-time opportunity, obviously, to help create new programs from scratch, and also for our existing mobile food shelf programs to help expand, further expand into their communities and serve more people. And so we are now starting the second year of that one-time grant, and so we've now given out 35 grants, many of them in the metro, but also expanding into greater Minnesota in places like Perham and Chisholm, Wright County, Owatonna, Montevideo, and Mankato, and other places. And so it's really taken off, and there was over 20 organizations who, unfortunately, we weren't able to fund doing this work, and so we know that we're going to have to go back to the legislature and look for more funding, future funding, to do this work. And so, you know, with that, just want to kind of give a snapshot of the program itself. But right now, I think, you know, it'll be really helpful for a lot of you to hear firsthand, you know, from an organization that's doing this right now. And I'm really impressed by, you know, when I went out to do a visit with Greg and Sue, just how their program works and how far they've come along in the first year of the grant. And they got the grant this year, and they've just done a tremendous job of really getting the program off the ground. And so I will hand it over to Greg and Sue to talk more about their program and let you know how they kind of got started.
Super. Thanks, Peter, for the introduction and whatnot. And I have Sue as well, Sue Gilman, on the line, and I have to say that without people like Sue, who's a key volunteer for our organization, we would never have gotten what we do now off the ground. So it's great to for her support, and we're going to kind of tag team things a little bit. And I'm thinking all of this legal stuff, I wish I'd known that in March of this year. It might have saved me a lot of agony, I think. So good stuff there. Anyway, what we're going to try to do is take you quickly through briefly where we have been and how we got to where we are today with our mobile food shelf program. And as you can see, hopefully everyone can see a little collage that we have of the various aspects of things. So this is real life. Some of these things actually are just last couple of weeks. We're, in fact, as I speak now, we're in the process of our volunteer team and project leadership delivering at a site today, as a matter of fact. So for us, I think the important thing, and Peter mentioned this at the very beginning, and I think it's critical, is the planning process and stepping back and understanding why are you doing mobile. And I'd just briefly like to share how we as an organization got to that point. The Christian Covered Emergency Food Shelf over the last 3+ years has gone through a fair amount of transformation from a leadership perspective, and got to a place where we thought we were doing pretty well, and stepped back and wanted to understand how well we were serving community. You know, we're fortunate to have some grant resources to step back and take a look at that. And, you know, through data that we got through Hunger Free Minnesota, many of you may be familiar with that organization and their data collection initiative. We were able to take a look at who we serve. And as a sideline or step back, we serve the communities of Woodbury, Oakdale, Landfall, and southern part of Maplewood. So that's about a population of 100,000. And lo and behold, we discovered, in spite of what we thought was doing a very good job, we were actually probably only connecting with about a third of the population that would qualify for hunger relief or support from our organization. So from there, we're able to use some of this data and understand sort of the geography of where people were that we were not serving, and began to understand or try to understand, you know, why people weren't perhaps coming to us, why people were not visiting us, and from that, do these online. Sorry, I got interrupted. Recognized there are a number of things. First, as I said, that overall we were only serving a third of the population that would qualify, but when we dug a little bit deeper in all of this stuff in the data, understood that we were only serving 1 in 10 seniors. And as anyone aware of a little bit in the hunger and food insecurity world, probably one of the fastest growing populations, maybe not in absolute numbers, but in percentage numbers, are our senior citizens that live in the community. And we really took this to heart and try to figure out a bit about, so how do we necessarily, solve this problem? And there are a number of constraints that we have in our existing fixed site. And for us, looking around and talking with others and looking at some best practices, and I have to say, frankly, planning on hearing rumors about a mobile food shelf grant, decided that one of the best ways to improve our delivery and improve our connections with the senior citizen population was through a mobile program. It would solve for us a number of things that we have with our existing situation. So to take a bit of a sidetrack, where we're currently located, not super convenient necessarily if you're a senior citizen to get to. It's quite crowded. So if you're at all sensitive to bumping into people or navigating on your own, it's a bit of a hustle and a bustle where we are. And so that was the decision we made to do a mobile food shelf to approach these populations specifically. Sue, anything that I've forgotten as relates to the analytics side of things to get us where we were?
No, thanks, Greg. I think you've covered kind of the early days of planning this quite well. The point, though, and he's made it very well, is that we were underserving a senior population, and all the research that we read through showed that the senior population is going to double between 2010 and 2030, and we were not prepared for that. And our pop-up program at least starts to get us that in a direction that we can sustain and grow on.
Right. No, absolutely. So thankfully, we got fortunate to benefit from the grant from Hunger Free Solutions, and then actually had to do the hard work of then figuring out, okay, what are we going to do, right? And I suppose we had done some preliminary planning, obviously, for the grant process. But one of the things I would say for anybody considering this, and we've learned and evolved over the 6-7 months that we've been implementing things, is be prepared and recognize that what you think will happen or what you plan to happen or what you figure you'll outfit or configure or do, you need to be flexible in terms of doing things, and that will serve you well, I think, through whatever process you go. So having identified the need and getting the grant, we then started working to identify partners as part of the program. What we wanted to avoid, we were not trying to replicate Meals on Wheels. You know, we were focused on building organizations and partners that had the opportunity to build or support a pop-up, and that's what we have. It's a pop-up food shelf. As you can, some of the pictures you can see, we bring everything on our nice shiny white truck, and partner with a variety of either Section 8 or low-income senior housing in the Oakdale-Woodbury area. And we bring the food shelf to our clients, our customers. And so part of that is just generally a discussion and education with those potential partners. Although, again, we're in the world, and you know, food shelves and mobile food shelves is a hot topic. Recognize that building management companies and the staff that are there, that's probably not necessarily a hot topic. So there's a lot of conversations, allaying of concerns, you know, not addressed necessarily in the legal stuff, but you know, we've signed the certificate of insurance programs for liability insurance and all that kind of good stuff. So you need to bring partners along and understand and recognize that they may not be at the same place you are. And so that takes a bit of time. It doesn't necessarily happen right away because, again, many of these organizations are fairly large, and it just needs to kind of work through their chain of command. You know, another thing that we did as part of this partner and part of this setting up process, and I would say the groundwork, is surveys. So we early identified a group in a building that wanted to work with us, and so we took that opportunity to better understand the environment that our customers and our clients, you know, live in and what they necessarily need. You know, again, from our perspective, a little bit not knowing what we didn't know, such things as how big a refrigerator did our customers have in their apartments? You know, was it a convenient-sized apartment refrigerator, or was it something that was more typical, you know, household size of things? Also understanding, you know, how our customers potentially prepare meals. You know, are people nuking, you know, single-serve options, or are they taking fresh, you know, ingredients to make meals themselves? And so for us, that was a critical component of understanding what to bring to avoid bringing a lot of things that then no one would take when you got there. And so I would highly recommend some level of research, whether it can be quantitative or at minimum qualitative, to understand, you know, what to bring to your clients, that kind of thing. So we were kind of had done all of that groundwork, research, and background, and I think we're beginning to be at a point to outfit our solution necessarily. Again, Sue, anything you think I've forgotten going in to the?
Just a couple of things I might want to add, Greg. I think that entering a senior complex and getting to know the residents and their dietary needs, and just for them to get to know us as an agency and for us to get to know them as a client. Because I think one of the things that we also learned is that out of the 100 and some that we serve currently, only about 5% were currently using a food shelf. And so this is an opportunity to really reach a brand new audience that we're certainly deserving of this opportunity. So one of the things I think we did really well is to hold not only meetings with the leadership of these organizations, these partners, but also with the clients, and virtually, you know, got to know them to understand, if we build this, will they come, and what do they expect of us? And what would they look forward to having us bring? And so the survey was really revealing in the fact that the seniors that we surveyed, and this was true of all of the different environments that we went into, they all desperately wanted us to bring in really good proteins. They wanted us to bring in really good produce. And then the dairy requirements were really the milk and eggs and yogurt portions of our portfolio. And then the fourth item was personal care. So we do bring in personal care items as well. The bags, the boxes, and the cans were all way down the list on the things that they really wanted us to support them with. So that made it pretty easy to design how much capacity we use for the top four things that they asked us to go do. Okay, Greg?
Yep, no, absolutely. And that design actually helps us figure out a little bit about what we needed to acquire and what we were trying to, what equipment we necessarily needed. Again, at the very beginning of part of the grant process, we, did research and made some estimates. But again, the reality sort of hits about what you're trying to do from an implementation perspective. And so we did a couple of things. As you can see in the image here, our nice little white shiny truck. And I thank the folks at Hunger Solutions every time we see it. We made a decision to buy new as opposed to used because we didn't want anybody else's problems. And interesting to note, and again, one of the things that we learned, finding a used truck with the size that we figured that we would want to use and be able to handle, it's not that easy to find. And in fact, the ones that were available of the size that we're considering had several, had over 100,000 miles on things, and I realized trucks go that far and more, but it was just something that we decided that wasn't a risk that we wanted to necessarily assume. Also, I would say, as you can see some of these images here in terms of the individuals participating, although we do have an overall project manager and a professional paid driver, the vast majority of the labor that's provided in executing these programs are volunteers. Also tend to be a fair number of women versus men because we do this during the day. So anyway, the challenge is with a truck, we want to make it what we jokingly say is volunteer proof. And so that led to a couple of things. You can see on the upper right-hand side of that, the collage there, the lift off the back of the truck is probably a bit larger than you would normally see in a commercial environment. That allows for, frankly, a larger margin of error to balance things, whether there are rolling racks that we have or coolers, and be able to enable people on them so they're not perching precariously on edges and that kind of thing. And in fact, it's easy to use. It doesn't fold and collapse because, again, we were trying to avoid, pinching of fingers and toes and things would necessarily collapse when folding up. You also can see sort of in the back in that lower corner, our buddy John, the camera ham, always in our pictures. We also made some decisions about how to, deal with the, rolling racks and the like. So we have a couple of U-boats that are there. And I will tell you, learned quickly about the things to secure these U-boats in. We had used ratchet tie downs at one point in time, or at least I tried to, because those are all the things that you could use, and they seemed great. But the reality is they turned out to be difficult to use and the first time through, and we didn't toss them out. We still have them, but realized quickly it wasn't something that we could necessarily use on an ongoing basis. So that was a quick change. And again, goes to I think my point about if it ain't working, try something new. Don't get so hung up on, sort of a commitment on something if it's not necessarily working out. So as you can see, we load and unload through the truck off the lift gate. And it's quite easy for folks to do, and we're moving 300 or 400 pounds. If somebody unloads it a little bit hefty, maybe 500 pounds on those rolling racks, and it seems to work pretty well. The other key component for us are coolers. Again, we made this long debate about bringing, refrigeration or non-refrigeration, and we really decided, given the proximity of where we are serving, so it's a 10, 15-minute drive tops, and that's when if you don't make the lights, we went with coolers as opposed to anything other, mechanical refrigeration. And that has worked well. We are able to provide, I think, 4 or 5 at least protein choices and 3 or 4 dairy options through, I guess we have probably 4 or 5, maybe 5 or 6 coolers that we use and bring on board to the truck. And then in tandem with those coolers, we acquired they're frozen blankets, so they're not the kinds of things that Second Harvest has, that are, but there are things, freezer blankets you actually freeze, and we use those on top of everything to keep things cool. So I think in a nutshell, again, the idea was to make it easy for everybody to use and set up. And with the equipment that you see here, we are in and out and serving somewhere in the vicinity of 35 or so households in 2 hours from start to finish. The last thing I guess I think I would add is sort of as I'm staring at the images here. The key thing for us in one of those plans going in was a community room or center to be able to distribute the product. Again, background, right, we're a complete client choice model, and one of the things when we wanted to implement this program is we wanted to make sure that we didn't or continued, I guess, our process of allowing client choice to necessarily choose what we provided them. So as you can see in a couple of the images, we've rearranged and lined up tables, and starting from sort of the heavier canned items all the way down to the end of baked items, folks walk through, generally with somebody helping navigate, a shopper assistant of some sort. After they check in, they go through and select from the variety of items that they see in front of them on these tables. While it's for seniors, they're typically shopping for 1, maybe 2 individuals. We again provide them a robust choice of not only canned and dry goods, but produce, dairy items, as well as frozen proteins and baked goods. And I think on average now, it's probably about 30 some odd pounds of food is what we distribute to each household that participates. So I'm trying to think if there's anything else more than that from an equipment and setup perspective. I think Sue did mention, it was mentioned a couple of times and mentioned by Peter in terms of the stigma, that one of the challenges in serving seniors is the perspective that I don't need it, there are others that need it more than me, or also the stigma of needing support and assistance is an embarrassing thing. One of the great things that we've discovered as part of this process, and as Sue mentioned, is the community aspect and the nature of this event. And it has become quite honestly really an event at these facilities where there are where everyone participates, and depending on their physical capabilities, some of the seniors participate in terms of helping out on the other side of the table, right? They'll help set up things, they'll help, assist other residents shop, they'll help them get their things back to their apartment and that kind of thing. And I think we've really been able to, through the engagement of everybody at the facility, create something that's a very positive and a look forward towards experience that allows us to get a participation rate of close to 90% of the residents are participating in this program, and it's just it's a really neat thing to necessarily see. And so,
Greg, can I add something to that? Because I think this is a really important portion of really understanding if your program is successful or not. And what I think has, this whole stigma portion has been something that has been a major lesson for us because we've overcome it so nicely. And one of the slides, earlier slides, was about being equitable. And so somebody asked, so what have you learned most about this program? And one is the fact that we needed to make sure that the first person who shopped had the same choices as the last person that shopped. And so we don't want to create any sort of environment where you have to compete or be down there early in order to get the good stuff. And so we've done a good job of making sure that it is equitable if you're number 1 or number 40 going through the line. The quality and choices are in place. The second thing that I've learned, and I think Greg and I were both surprised by it, is that this is such an event at these partner locations that seniors show up early. We did not expect to have half of our clients actually waiting for us to arrive, but it turns out that it's more than just getting food. We're actually kind of their entertainment for the morning or the afternoon that we're there. And so it's actually, community building is, they look forward to seeing us. They look forward to, of course, getting the food, but they also are learning their neighbors and how to be a bigger part of the environment in which they live. Some of the clients have even offered the fact that this service has nearly cut their food bills in half and has given them some margin for other things that they needed to take care of. So I just wanted to offer that as well, Greg.
Yep, super. So in a nutshell, I think we launched in March with our first one. We're up to 3, plan on getting to 4 sites by the end of the year, serving about 100 senior households every month now. And as Sue mentioned there, the vast majority are net new households, 95% for sure. And we're excited about where we can take this program in next year as well. But I think the key thing, if I'm sitting on the other side of the phone, is be able to ask questions. So I want to wrap it up at the moment, and obviously, please feel free to ask questions here, as well as I'm not sure. I think you have our contact information, but if not, we'll make sure you get it. More than willing to answer any questions you might have, share our experience, as well as if you're in the area and we're running one of these things, invite you to come by and see it in action, because I think that helps as well. So back to you, Anna.
Great, thank you so much. Thank you, Peter, Sue, and Greg, for sharing your insight with us. Before we move to questions, I wanted to briefly let you know about several resources on the Public Health Law Center's website under Access to Healthy, Affordable Food. So we have one resource about liability protection for food donation, and then we also have a mobile food shelf resource that will be coming soon, and we will be sending an announcement to all webinar registrants when that is published. So I also wanted to let you know about an upcoming webinar this Friday that will be focused on supporting healthy eating in Greater Minnesota, understanding and improving the grocery and small store landscape. So that'll have Karen Lampier from the Regional Sustainable Development Partnerships, Julie from the Public Health Law Center, and Teresa Ambrose from the Minnesota Department of Health. And you can register in the link in the slide. We also have another additional webinar that will be happening on Monday, October 17th, and that will be focused on using law, policy, and practice to support access to healthy and safe food in Minnesota. And so people from the Minnesota Department of Health, as well as the Minnesota Department of Agriculture and the Public Health Law Center will talk about ways that you can connect with local inspectors to work together to support access to healthy and safe food. All right, and so now here is the contact information of the speakers today. And now we will move to questions. So there was a question about working with Native Americans on reservations in food desert areas, and Peter, has Hunger Solution worked with any food shelves who worked in these areas?
That's not yet, but that's definitely, something we'd be willing to do with this grant. We're definitely looking at going back to the legislature to get more funding, and so we'd be happy to work with Native American communities to get them a grant so that they can start this work. And we've definitely heard of some concern, but I know some programs just need some time to kind of get their plan together and get going, so we'd be happy to work with them.
Great. So then we had another question about asking whether any towns that currently have a mobile food shelf have seen a decrease in farmers market participation, which would be a concern in rural communities. Peter or Mary, would you like to address that?
Yeah. I mean, I think that's a great question. It's something we haven't looked into, but we also work on the Market Bucks program, and so I think we've seen definitely an increase in people participating into going to their farmers markets through the Market Bucks program. And if you're on the call and don't know what that is, it's just basically a match. So if somebody uses their SNAP card at the farmers market, they can get a match up to $10 on what they spend. And so from what we've seen, the participation numbers are really high this year while doing that, and we've definitely encouraged, food shelves to be, encouraging their clients to use this as an opportunity too. But it's a great question. It's just something we haven't looked into yet.
Great. Thank you so much, Peter. Now there's a question about whether mobile food shelves need permits or licenses to operate in cities and how they could go about learning more about that. And is this something that could be addressed in comprehensive plans? Mary, would you like to take that?
Yeah. Thanks, Anna. So I think that's a good question, and I think that when I think about any kind of like legal requirements, what I take this question to be asking is, are there licensing and permitting requirements at the local level as opposed to at the state or federal level? And so when again, going back to, when I first started talking about this, I kind of break the mobile food shelf operation into two different general umbrellas. One is things involving food, and then the other one are the issues that may involve the vehicle or driver. And so I'm going to start with the vehicle and driver piece. So most of what I was talking about earlier today really involved regulation at the state and federal level of vehicles and drivers. And I think that when you're wondering about the role that a local government might have in regulating something, it's good to keep in mind what authority a local government has over different parts of this question. So, so then that raises the question of like, what kind of local authority does a local government have over a driver or a vehicle? And so we know that the state is responsible for driver's license requirements, right? The local governments are not creating separate requirements for driver's licenses. Likewise, vehicle, like the bigger vehicle registration questions, like the commercial or non-commercial vehicle registration, the DOT number, those kinds of things would not be in the purview of a local government. At the same time, local governments obviously are involved in some kinds of traffic regulations, and so whether or not it would involve a permit or a license, I don't know if I could think of a permit or a license necessarily, but there might be traffic regulations that you need to be aware of in different municipalities that could apply, like where can you drive, depending on how big your mobile food shelf is, like can you drive it in this certain neighborhood or on this street? Are there any restrictions? Are there any parking restrictions that you might have? Any noise considerations or things like that. So thinking about those areas that local governments regulate involving drivers and vehicles. And anyway, I can't think of any others off the top of my head under that umbrella, although other than if there's different zoning requirements around, again, where you can have the vehicle. Then shifting to the food piece, as I was talking about, there's two different components, when you're thinking about food regulations involving food establishment licensing or regulation and food safety. And again, those two areas really, for the most part, are regulated at the state level. However, some local governments may have delegated authority from MDA to regulate food establishments in their locality. And so if a local government has that authority, that delegated authority from MDA, then they would be more involved in inspecting or regulating a different mobile food shelf. But it really, I think, depends on the specific locality, and so you would need to understand whether or not the city where you're operating has delegated authority from MDA. The food safety requirements, the food code applies regardless, and maybe some delegated governments may have, may inspect in a different way or something, but really the state regulations do apply. So I don't think that would really come into play. Where a local government may be more involved in regulating a food establishment might be through their zoning laws. And so that's an area where if there are certain restrictions on where a food establishment may be able to be located, then maybe a local government could regulate that. So you need to be aware if there are any zoning restrictions. But I don't think it's extensive as far as I can tell. And then going to the question about whether or not these things can be addressed in comprehensive plans, I know that there's a lot of interest in local communities and amongst SHIP grantees about how to use comprehensive plans as a vehicle to advance access to healthy food and more equitable access in our communities. And I definitely think that comprehensive plans can identify, serving those communities or neighborhoods in a community that have lower access to healthy food. And one of the ways I think that a comp plan might be able to push this issue forward is to, maybe think about some mapping or some planning as far as where those neighborhoods are that may have low transportation access and low income, where there are certain neighborhoods that have a higher need, and a comprehensive plan could, identify, in some of the background information, that need in a community as far as hunger and poverty, and really, indicate the local government support to partner with different direct service agencies, and also maybe provide some government support and services to advance those efforts. So those are the things I can think of offhand. If you have any additional follow-up questions on that, in that regard, please contact me directly, and I'm happy to have more of a conversation.
Great, thank you, Mary. So now there is a question about whether the senior population served by the mobile food shelf had different food needs than your traditional client population. This is for Christian Cupboard. And if so, did you have to make any adjustments in food purchases or request certain kinds of donations? Sue, would you like to start?
Sure, I'd be happy to. Thank you. There were just a few things that we did have to adjust. One is when it came to proteins, we made sure that we always had eggs available. And we also had to go and buy protein supplements such as Ensure or Glucerna. And probably the only other thing that we don't carry nor have a really great solution for sourcing are prepared meals. We like to bring forward healthy and nutritious meals, and the good news is that we did partner with a local grocer who is now donating 2 cases of prepared meals that we are using in our service. But we really need to find solutions because, as Greg mentioned, some folks don't cook, they reheat, and finding nutritional offerings that we can put into this program has been a challenge. Greg, do you have anything you want to add to that?
No, other than the challenge on that front with those prepared meals. Some things work one time, and then the next time those same items don't. So it is definitely a logistics and a choice challenge to get the right things to folks on that front, without a doubt. I think everything else we've been able to source pretty effectively through our existing acquisition strategies.
I can tell you that every senior we serve takes bananas.
Yeah.
So
yeah.
That's always a hit. You can always guarantee they'll go.
Greg and Sue, this is Mary. I had a follow-up question because you were talking about prepared meals. And I know that in my presentation, I was making a distinction between like a meal service delivery and the kind of grocery service that I generally think of as mobile food shelf providing. Is there a distinction there when you talk about prepared meals? Is it more like a meal service piece, or is it, I mean, I wasn't sure what you meant when you talked about that.
Oh, that's a great question, Mary. Greg and I were referring to frozen meals. So frozen prepared meals, things that could be microwaved but delivered through our service.
Got it. Thank you. So like it's a grocery item, but
right, exactly.
It is a grocery item, right.
Peter, did you have anything else on that question?
No, I think they covered it well.
All right, there was a question about different staffing needs between a traditional food shelf and a mobile food shelf. Maybe Peter, would you like to start?
Sure, yeah. I mean, I think it depends on the different model. Obviously, some need more staffing than others in doing this process, and others have the volunteers that can run a program like this. And you know, depending on the vehicle that you have, you might need a staff person to drive it, just because of the license requirements there. But in most cases, you know, you probably have a staff that can kind of run the program either full-time or part-time, and then have volunteers really help out with the bulk of getting the food to and from the food shelf, and then having partnerships with the locations, like a senior area where you have volunteers meet you there, or volunteers on site, some of the clients who can help out as well. So.
Great. Sue and Greg, do you have anything to add?
Yeah, the only thing, I mean, a couple of things for us, just the numbers, right? We have 2 part-time folks, a project manager that kind of coordinates everything from a volunteer and a site perspective. And then we do have a driver that's staff. Now, the truck we have doesn't require a commercial driver's license, but does require a DOT physical. So we made, you know, that makes sense from that perspective. One of the things where we're headed towards on the staffing front, though, from a volunteer perspective, is to better understand how to create teams that will take responsibility and potentially ownership on an ongoing level to be there as those volunteers. Not to necessarily direct or manage, but be the folks that provide the volunteer manpower, you know, for a specific site. Especially since, although while we do get a number of seniors that wish to volunteer, I mean, it is a senior site, and we are moving and a fair amount of stuff around with lifting and unpacking and packing and that kind of thing. But I think the great thing about this program, not our program, but any program that gets started, is you have the opportunity to build gradually and learn. So I can tell you that the third one that we did, we avoided all of the mistakes that we made on the first 2. So it seems to work well that way to phase things in.
Great. There was another question about, you talked about how the experience of the mobile food shelf was something that was celebratory, and I was wondering if you could share strategies for connecting with your clients and making the food shelf a celebratory experience for Greg and Sue.
You want to take that, Sue?
Sure. You know, like I said, it's almost like when the circus rolls into town. The seniors, the way in which they live and socialize has been really fun to learn. I mean, they hang out in the community room. They see the big white truck rolling down the road, and all of a sudden, you know, things are rolling into the community room, and it becomes really exciting. They get excited. It's almost like Christmas is rolling off the back of the truck. What did you bring me today? It's exciting, and it's been really fun watching them kind of build their community around it. We've had a few folks actually walk up to us and say, "This is great. In fact, I didn't know half the people I've met after I started participating in this, and it's been wonderful." So I think that they look forward to it, the feedback that we're getting, and we stay very close to that feedback because once a week we do a different location. that's just ongoing feedback that we're always looking for. And we try to always add something new to it, so it's kind of a nice surprise that, oh, like this week we had an excess of frozen strawberries or something like that where it was a nice treat. So, Greg, do you have something you want to add to that?
No, I think that the other aspect is setting things up to begin with, right, and engaging the management team there, but, you know, getting people enrolled, signed up, you know, kind of, again, sort of making it an activity, an event, much like any of the other things that kind of go on.
Great. So, Peter, with your work through the Mobile Food Shelf Network and through the grant funding, have you noticed any common challenges, or are there anything that you would share that you would want food shelves to know?
Yeah, I mean, I think what we've been talking about today with the legal requirements definitely has been a challenge, but I think, you know, the fact that there's now a resource for it is going to be very helpful. You know, I think that's one of the things that kind of comes up as a common theme. Also, just not knowing where to start sometimes, like where do I start to begin to identify where those needs are in my community. And so, you know, we can definitely help out with that process and help put folks in contact with who's already done this, so you don't have to reinvent everything that has been done with mobile food shelf programs.
Sue and Greg, do you have anything to add?
No, I think the most challenging aspects, frankly, are sort of the whole vehicle thing, and I would just encourage folks to, lo and behold, I found out sort of a bit after the fact that we have a new board member whose career before that was logistics. So, you know, reach out to your network of volunteers and board members and whatever, because you might be surprised, you know, the resources that are available there that can help you avoid, you know, just not necessarily mistakes, but a lot of wasted energy tracking down stuff, because as we all know, connecting with the federal government about things might take a little bit more time than you would hope it does.
I'd echo what Peter said regarding where to start. I work with a lot of different food shelves as well, and I partner with Peter on a few projects. And learning the community, understanding the densities and the need requirements, and then customizing the program are all the beginning elements of that planning process. So getting started is always the hardest part.
Great. Thank you. I think we have time for one more question. There's a question about interest from SHIP grantees in supporting this work and ways to develop partnerships with local departments of health. Maybe Peter, would you like to start?
Sure. Yeah. I mean, we'd be happy to partner and talk to anyone who's interested in doing that work. Any way we can continue to fund these programs, even outside of state grants, you know, counties SHIP, that would be great. You know, we'd be happy to talk through that process more, because that's going to be a big need going forward for a lot of organizations, is how do we keep these programs funded for the long term. So.
Thank you. Greg and Sue, do you have anything to add?
No, other than I think one of the things that we've discovered is a desire to try to use our assets and help in as many ways as we can in our surrounding community and area. So while we've started in our own backyard, for lack of a better description, with dealing with mobile, I know our board and volunteers are interested in how do we help others that may not necessarily have the asset, and figure out how to partner, you know, across organizations to make sure, going back to that diagram at the very beginning, right, the equity versus equal, help others, you know, be able to take advantage of assets that we might be able to deploy.
The only thing I'd add to what Greg has said and Peter has said is that we are staying really aware of all the great work that University of Minnesota Extension, as well as a lot of the health services organization in town, are producing and providing programs around better shelf, better health, and how to continue to leverage and elevate our mobile program with those important sources and tools.
Great. Well, thank you so much. I want to say a big thank you to our presenters and a reminder that the recording will be sent out within the next 2 days, and we will also be sending a follow-up email when the resource is released. So thank you so much, Greg, Peter, Mary, and Sue.